14.2 Urine formation. Steps in urine formation include, first, glomerular filtration, that is followed by tubular reabsorption, and the last step, which is tubular secretion. Glomerular filtration is driven exclusively by blood pressure. Solute filtration is dependent upon size. Everything is going to be forced out of the glomerular capillaries into the filtrate except intact blood cells and platelets and large plasma proteins. These intact cells and large protein molecules are simply too large to be forced out of the glomerulus. What does get pushed out of the blood is going to be caught in the glomerular capsule. We call that the filtrate. The filterable blood components include water, nutrient molecules, nitrogenous waste products, salts, drugs, toxins. All of these small molecules in blood are going to be filtered and pushed across the glomerular capillary bed. Now, if we look at the components that are filtered out, is all of this trash? Is this all waste material that we want to dispose of? Anything that remains in the kidney tubules is going to pass through the proximal convoluted tubule, the loop of the nephron, the distal convoluted tubule, eventually into the collecting duct. Anything that stays in those tubules is urine. And obviously, if we look at this list, there are some things that we would want to save. So the next step of urine formation is tubular reabsorption. Many molecules are going to be selectively reabsorbed. They are going to be pulled from the filtrate back into the blood. This begins in the proximal convoluted tubule, continues down through the loop of the nephron. So some molecules that originally were filtered, put into the trash, are going to be pulled back and reabsorbed into the blood in the peritubular capillaries. Here is a table that shows a list of different substances, how much is filtered, how much is excreted, and how much is subsequently reabsorbed. About 180 liters of water per day are filtered through the glomerulus. Most of that is reabsorbed. Obviously, this is going to be variable depending on fluid intake, activity levels, different things. But about 99% of that water is reabsorbed. It's conserved. 630 grams of sodium, almost 100% of that is conserved. Now again, this is going to be highly variable depending on sodium intake and activity level. There in the middle, glucose. Glucose is food. So about 180 grams a day is filtered out of the kidneys. None of that should be excreted. 100% of that should be absorbed in the proximal convoluted tubule. If you do have glucose in your urine, that is a sign of diabetes. What happens in this case is blood glucose concentration is simply so high that all of that glucose cannot be reabsorbed, and consequently some of it does remain in the tubules and occurs in urine. Down at the bottom, protein, blood cells, those should not ever appear in the filtrate, again because those are too large, they should not be filtered out. The third step is tubular secretion. Some of the molecules that were reabsorbed in the proximal convoluted tubule are subsequently secreted back into the filtrate. Furthermore, there are some non-filterable solutes that do not get filtered originally that are specifically removed from the peritubular capillaries and placed back into the filtrate. There are some drugs that are removed this way, water, salt, and also protons. And so this is a way that we can really fine-tune blood composition as that filtrate continues through the loop of the nephron into the distal convoluted tubule. this tubular secretion can fine-tune the blood. So again, we mentioned previously that there is a very close association between salt concentration, water concentration, blood volume, and blood pressure. Also, whenever we fine-tune the proton concentration, that is going to determine the blood pH. So here is a look at the nephron. Once again, filtration occurs at the glomerulus. That filtrate then is captured by the glomerular capsule. The filtrate moves through the proximal convoluted tubule, the loop of the nephron. This is where the tubular reabsorption is taking place. And then as we come back up the loop of the nephron into the distal convoluted tubule, this is where most of the tubular secretion takes place. Anything that remains in the collecting duct is urine. That collecting duct, remember, goes down through the pyramid of the medulla. The reason that the pyramid has that striated appearance is because the collecting ducts of many nephrons run parallel through that section of the kidney, forms that pyramid with the striated appearance. Those individual collecting ducts open up into the small openings, the calyces, which drain into the opening there in the kidney, eventually through the ureter to the urinary bladder.